So I started wearing glasses when I was 4 years old. And when it's 1960 and you're wearing glasses, a couple things happen. One is my glasses are back in style today. But my kids would look at those pictures and they could always pick me out. And they always thought I looked a cross between Ralphie from A Christmas Story, Al Franken, or Henry Kissinger. I like Henry Kissinger a little bit better. And a couple things happened. So I got used to wearing a lot of tape in those days. I got used to hearing my proper name a lot, and my proper name is Randall Dean, and I'll explain why. And I had a very special relationship with our optometrist. So I grew up in this very small town in Iowa, a couple thousand people. And in those days, having glasses at an early age, and I had some vision problems at an early age, and so I went a lot. And so it's 1960 in a small town in Iowa, so I would take my bike by myself, 5, 6, 7 years old. You'd leave your bike by the front door and you'd go in. And so when I went into the optometrist's office, there was a woman at the desk, and thought she was 80 years old. She was probably 30 years old. Desk was high enough that it was like a principal's desk, and they would peer down, and you were told to go in the waiting area. And the waiting area was your typical waiting area. There were no windows. There was a big fish tank that I was not allowed to touch. I think the rules for the fish tank were, for me, don't put your fingers on it, don't put your nose on it. 10-year-old National Geographics, old Sports Illustrateds, and Reader's Digest. So when you're 6, 7 years old, I got myself into a little bit of trouble. But I had this great relationship, and the optometrist said I had the personal records of his office. And my record was the most breaking of your glasses within a 24-hour period of time. So you're young, you're active, you're outside a lot, and with those glasses, they were pretty easy to break. So my parents were very poor and didn't have a lot of means. So when I broke my glasses, it was a very big thing. So on one occasion, I remember specifically, my mom talking to Dr. Vermeer, Dr. Robert Vermeer, and explaining to him, here we are, I had just gotten the glasses. I can't remember if it was that morning or the day before, and there we are, they're broken. And Bob Vermeer looking at my mom and saying, you know what, yeah, if they broke that quickly, they must be defective. Yes, I fell out of a tree, but they must be defective. So over the years, as I went to Dr. Vermeer's office, the same drill. You'd walk down the hallway, past the little glass showroom, and the older I got, the more I could go in and look at the glasses without being supervised. And you'd go back to his exam room, and you would start out very quickly, not with an eye exam, but he'd pull up a chair and say, what's going on? What's going on in life? Talk to me about school. Are you taking science? Are you taking math? What are you doing? Are you playing sports? And so my parents, we think they completed the 4th grade. I'm not sure they both completed the 4th grade. But it was the Depression. They were the oldest children. They were forced to work, so they had no education. So he was the one person who was educated. He wore a tie. He wore a suit. And so when he talked to me and told me about, what I should do in life, you listen, especially as I grew up. And throughout my life, Dr. Vermeer sent me notes, grade school, high school, college. And it was always the same note. I believe in you. I think you're going to do great things. Keep working. Think of the sciences. You should be an optometrist. You should come back and take my practice. And throughout life, that's what I heard. And I knew I had a special relationship when I realized later not everybody got birthday gifts from their optometrist. So I used to get plastic models. A number of years ago, when my dad was just at the end of his life, so I'm back in Sioux Center, Iowa with my dad. We go to Dr. Vermeer's office. Same sort of thing. We'd go into the exam room. We'd talk for a while. We'd go across to his office. And many times we'd go in his office and talk after the exam. And over on the shoulder, against the wall, there was a plaque. And the plaque I'd seen a million times before. I recognized the plaque, but it just finally dawned on me what it said. And it said it was a terrible thing to see and not have vision. And that's a Helen Keller quote. And it kind of dawned on me sitting there with my aging father, and of course Dr. Vermeer was very old himself at that point, and that was his life. His life was thinking and believing about people, thinking and believing in the good of people, and really taking the extra effort to encourage people to do good things in life. And that really had a profound effect on me. So a couple years ago, we had a couple people call us and say, we'd like to have a meeting. And the meeting was going to be at the Beirut in the back room, and there was going to be wine, so I knew something was up. So several organizations got invited to this meeting, and they were parents with children with autism. And autism is an epidemic in this country. 1 in 54 boys, 252 girls, about 188 overall. And what the parents began to tell us was their journey having an autistic child. And even though autism had gotten better from a service standpoint, they, in very determined voices, said, you know what, there's got to be a better way. There's got to be a better way in this community for us to take fragmented services and to put them together. Because we felt that we had to make it up on our own. We had to get a diagnosis for our child. We had to navigate through school. We had to get them the right resources. Autism is quite a spectrum, and so as the brain is affected from a developmental disability standpoint and affected, it can affect kids in different ways, so different things work for different kids. So they had to find their own way. So not only did they have a diagnosis problem, they had a treatment problem, they had an education problem, a financial problem with all the financial issues, and they were saying is there's got to be a better way. You need to help us, and they were so determined. We said, sure, we'll help. So we decided to call a meeting. And the meeting was with a large number of organizations. And to be blunt, the people that came probably weren't very happy. They were pretty, some were a little cranked up of like, who in the heck, put you guys in charge? And why are you having this meeting? And so you fast forward 2 years. Those folks that kind of got, brought to the table, we had a few people drag us along, they now form an autism collaborative. 16 different agencies work together, facilitated by the Great Lakes Center of Autism. 6 of those organizations have relocated to the campus of Toledo Hospital, Toledo Children's, and they're a center there today that has an early child program, an early intervention program. They have started an after-school program. They had a summer program. They had a mentorship program for high school students working with kids with autism. They've increased their services from serving 200 children to 500 children. They touch 500 families. They have rooms to allow patients, parents and their kids to go through and learn social skills in a very private fashion through some generosity of some donors, in this case the automobile dealers. They created a sensory room, which really works well for some kids with autism. They raised $1 million, et cetera, et cetera, et cetera. And it all started with some folks' passion. Again, not necessarily big money. It was just taking ideas, taking their passion and saying, you know what, let's connect the dots. If we can connect the dots, we can do great things. And that's indeed what's happened, and we feel like we're just on the verge of doing even better things. So 5 years ago, we got interested in obesity. Obesity is another epidemic, a huge epidemic. And it's interesting, when we started looking at obesity, we got very quickly into nutrition. And nutrition very quickly got us into hunger. And there is a close association between the two, and hunger is a huge issue. It's an epidemic as well. 1 in 5 residents in Lucas County dealing with hunger issues. Across our country, we have probably 50 million people that live in homes that are food insecure, 18 million children that live in insecurity for food. And as we began to look at it, it's the same sort of thing. How can we live in the Midwest? How can we all have jobs and resources and food in our pantries, and yet we have people that live hunger, that have hunger in their lives? And really what we decided to do is, well, we should create a hunger-free community. The communities that we touch, we should be hunger-free. So we began to work with some agencies, and we began to work with Toledo Seagate, and we decided to start a food reclamation program. And what that means is food is prepared and not served. It can be reclaimed, packaged, frozen, shipped off to maybe one of the food pantries. And so in the first few months that we started, we worked with Hollywood Casino. We had hoped to do about 20,000 pounds of food, which is in essence 20,000 meals, not quite. And over a 3-month period of time, working initially with Hollywood Casino and others, 2 part-time people, we've reclaimed 30,000 pounds of food. And now the goal for the group working is 100,000 pounds of food. Now, That's not going to solve hunger in our community, but it's a start. And the investment there was incredibly small. Again, it was just using the resources in our community. So from that interest in hunger, we've also gotten very interested in the social determinants of health. So we all want communities where there's great health. We want communities where we all kind of have the opportunity for my health and well-being. So your individual health is based on a couple things. You're seeing a doctor, the healthcare parts of that is about 15 to 20%. 30% is related to genetics, but 60%, the part that defines a community, is really the specific issues of individual choices relative to your health and what we would call the social determinants of health. And that's where you grew up, who your parents were, what kind of house, the education opportunities you have, did you have a job, did you have food on the table, was there clean air and water, et cetera, et cetera. And those social determinants of health are incredibly important as we think about the health and well-being of our community, and there would be no reason that we shouldn't comprehensively address those. So 3 different stories. One story about people taking time, having a vision for people, working hard on an individual basis with people, and having a vision for a community to live in. The second thought about connecting the dots, taking the resources and everything we have in the community and connecting those dots on a go-forward basis. And the third story about having a vision and then letting a vision go and seeing where a vision takes you. So when we think today about rethinking about Toledo, what do we think and believe Toledo should be? The question you'd immediately ask every one of you was, well, what is the vision of Toledo? Greater metropolitan area, what is the vision? What would you write down today? What do you think it is? My guess is we wouldn't have an agreement on what that vision would be. Maybe you could say we don't have a vision. And we all know one thing specifically, vision doesn't happen, strategy is important, but if you don't have a vision of where you're going, we can talk about a lot of pieces and parts, but we need a collective vision for our community. So we came up with one today, since we're here today, and we thought, if you look on the internet and you start looking at the internet about Toledo, Ohio, what are we? Well, we are the city of glass. So let's go with that. Let's go with the city. What if our vision was to truly be a city of glass? And that we take 3 components of glass. And the first one would be art. What if we were a city of art? So when you came in today, now some of you would define us as a city of art. I think if you ask most people in the community in Ohio, what do you think of Toledo, Ohio? They wouldn't say we're a city of art. What if we were a city of art? What if we thought of ourselves as a city of art? We have great art. We have a great art museum. We have great educational, aspects for art. We've got talented people here in the arts community. We've got a great arts commission. What if you had art throughout the city in a map where if you came to town, you could go from business to business, community to community with various pieces of art that people established, that people started. What if we were a city of opportunity, taking all those social determinants of health, taking every one of them and saying, we're going to be a hunger-free community. We're going to make sure there's great housing in this community. So we're going to connect the housing community. We're going to force them to come to the table, and they're all going to work together. And if we went through all those social determinants of health and said, you know what, in our city, we're going to think of things in a different way. And finally, we would be a city of innovation. And so when you begin to think about our new vision for the future, what we could be, it would be really taking the things that we have in our community and connecting them together. If you started to look at a community, you started to list the things you'd want in a community, you'd probably say, well, you'd want a great art museum, you'd want a great symphony, you'd want an imagination station, you'd want a great metro park, I'm going to forget somebody here, you'd want great schools, you'd want great sports, you'd want great school systems, you'd want a great arts community, and the list would go on and on and on. And those are the things that we have in our community, and if we can connect those in a very innovative fashion, and if we can provide opportunity for people to live the health and well-being that we want for each one of us, and if we can think of ourselves differently like a city of art, we truly can do some great things over the next decade and all create the Toledo in the greater area that we would all want. And that's kind of what we're hearing today. So our thought for that is let's begin. Thank you very much.